Welcome to today's broadcast. My name is Colleen Patterson, and I'm the Director of Employer Services and Compliance at Savoy. As the world slowly recovers from the COVID-19 pandemic, HR professionals are now facing what may be the biggest challenge of their careers. COVID-19 has definitely ushered in an entirely new era of work, workplaces, and even worker engagement challenges. As we know, the CARES Act was signed into law on March 27th and included things like a one-time payment to individuals, certainly strengthens unemployment insurance, and provides additional healthcare funding, as well as loans and grants for businesses in the hopes to deter layoffs. But these sweeping measures also alters the rules for employee benefits, affecting health coverage and retirement savings, among other things. Returning employees to the workplace during and after the COVID-19 pandemic won't be as simple as simply announcing a reopening or a return to the workplace date and carrying on business as usual. Not only will many workplaces be altered initially, some changes may actually be long-term, well beyond a widely available vaccine. The details of each employer's plan to return to work is absolutely going to be different. But there are some key issues that most employers will need to understand, and they should start preparing now for what that's going to look like. To set you on a path, we're actually beginning a new series and starting the conversation about the road to reopening. Joining me around the table today are Chris Hanley, who is our Regional Director for the PA and Delaware markets, David Pikus, our Regional Director for New Jersey, and Jerry Gallo, who is our Senior Vice President and oversees our New York market. So David, let's get started with you today. So generally speaking, what is the latest on how carriers are covering COVID-19 testing and treatment? Do we expect this to have an impact on claims, which ultimately affects renewals? What do you think?
Thanks, Colleen. It's a good question. The carriers have agreed to cover COVID-19 testing and treatment without copay or cost share. So the next question is coverage of the antibody detection test. The good news is that carriers, at least the major carriers today, have agreed to cover FDA-approved tests when ordered by a provider. So the next question is, what will the effect of COVID-19 virus be on renewals? Well, we know that COVID-19 treatment is expensive. But keep in mind that elective surgeries have come to a standstill. And as a result, claim costs are down considerably. We've seen proof of that as carriers have delivered financial results. But if you look at other catastrophic events that have occurred in the past, like Superstorm Sandy or 9/11, their effects on claims, it would seem to indicate that claims will trend lower. As producers look at how this might affect renewals, based on the timing, it's possible that it could have a positive effect for experience-rated groups, but it really remains to be seen. The important thing to know is that we must help and advise our clients to get back to work and to their offices safely and efficiently. Back to you, Colleen.
Great, thank you, David. So it sounds like it's something we want to continue to keep our eye on for sure. So Chris, moving on and keeping in mind the road to reopening, we're starting to see headlines of insurance carriers providing premium credits to customers. It sounds good though, right? So why is it happening, and is this short-lived? Is it good news or bad news?
Well, that's a very good question, Colleen, and it's a timely one as well. And you're correct. Sort of as we've seen this evolve, what we see is all the carriers they started out being very thoughtful in terms of payment plans for groups that weren't able to pay, or they were slow pays, and that has sort of transitioned into this idea of premium credits. And to answer a couple questions, I think we're going to see more of it, particularly because what we're seeing is the largest healthcare provider in the country, United Healthcare, seems to be leading the way when it comes to providing financial relief in terms of in the way of premium credits. Specifically, United Healthcare has committed $1.5 billion in relief. This includes all lines of coverage, not just commercial, but also Medicaid and Medicare. A few things, though, that I think are important to discuss is how the relief will be distributed. And frankly, that's going to depend on the line of business. So for instance, the Medicare segment, United Healthcare will be waiving the cost of sharing, the cost sharing, sorry, for certain services. So for instance, if there was a $2 copay, maybe now the copay would be $0. And again, I don't know that that's the actual number, but you get the idea is that they're going to be waiving some of the cost sharing for the member. On the Medicaid side, the help will really come in the form of food and security. For instance, United Healthcare will make sure there are nutritional meals for those people who otherwise wouldn't be able to get it. On the commercial group insurance market, which is probably the bulk of the audience here today, is that the relief will take the form of a premium credit, and it will be for fully insured customers only. So that's important. So if you happen to work in a market where you can sell the United Healthcare or Oxford All Savers product, and also self-insured programs, those plans will be out of scope. So it's for fully insured only, but it's for all size groups. And the credit will be based on your membership at the end of May. Once that's determined, the credit will be applied to your June premium and reflected on your July bill. So I think it's a wonderful thing that United Healthcare is doing, and I do think that we will see this in more and more markets. Now, of course, that was just a very general overview. So for more details, there will be an FAQ that will be coming out in the next few days, and with the specifics. Just one other thing, Colleen, if I may, we're noticing on the specialty carriers, your ancillary lines of coverage, is they're also seem to be taking a thoughtful approach. We're seeing most of them giving a rate pass for the upcoming renewal. And we also have seen recently, MetLife has refunded 25% of the dental premium for April and May. So Colleen, I think we're going to see more and more of it. And I think it's a very thoughtful way that carriers are helping.
Thanks, Chris. So based on what David and Chris are both sharing, it sounds like our carrier partners are doing what they can to help us as we continue to look forward to the road ahead. So Jerry, one of the other questions that I had today was, as employers begin to prepare for workers to return to the workplace, what should brokers be considering when consulting on upcoming renewals?
Well, thank you, Colleen, for asking that question. I think this is a good way to wrap things up. And Chris used the term thoughtful quite a bit. And many of us have to be thoughtful in light of this unprecedented time that we have. There's a few things that I'd like to address. And first is reviewing current plan provisions with things such as wellness and employee assistance programs. And that will allow you to help your clients and their employees with their mental well-being after being quarantined for such a long time as a result of this COVID-19 epidemic. So there's a couple of ways to do that. I mean, we've got to embrace technology. All of you should be embracing technology during this new pandemic adapted economy. A little phrase that I got from a friend of mine who is in social media, and that's what their industry's been using. And many of us have to embrace this social media touch because face-to-face meetings just aren't possible right now. There's a tremendous opportunity for increased engagement, which is sorely needed at this time. People just want to be heard. They just want to know that we're there for them, just like you're there for your clients. So whether or not the group has changed their plan already, whether they're keeping the same plan or not, it's a perfect time for you to reintroduce plan benefits. Try to focus on this population health management. Preventive care is covered at 100%. Encourage them to go for their annual physicals. Encourage them to get their blood work done. Many people are staying away from emergency rooms and staying away from elective surgery during this time period, but it's really important for them to stay healthy. So underscore those things. We're all susceptible to unintended consequences that can be managed or even quite possibly prevented during this time. So by getting those preventive care visits done, that will help. I've read in several articles that cancer diagnoses are being undiscovered, and some cancer patients are going left untreated. That's something that you want to make sure you underscore and you help people realize that they shouldn't be hiding. Heart disease, things like that are being suppressed, and we want to make sure we get people the right care at the right time. So again, engagement is critical right now. So keep that at the forefront. Lastly, I would say, discuss the potential value in offering non-health benefits, i.e. short-term disability is coming to light, to supplement the current employee package. Those are important things for you to look at as well. They want to know, they want to hear from you. So most of all, during this time, being thoughtful and empathetic is the most important thing you can do during this unprecedented time. Thanks, Colleen.
Great. Thank you, David, Chris, and Jerry, for sharing your insight today. The information has absolutely been very helpful for our broker community. At the end of today's broadcast, you will receive a short survey of 3 questions. We ask if you could take the time to complete the survey, and as a thank you, we will provide you with a on the road to reopening employee benefits checklist. So definitely it's something that you can share with your clients. As always, should you have any questions, please reach out to your dedicated Savoy team and continue to use the resources available in the COVID-19 section of our new and improved website at savoyassociates.com. From all of us at Savoy, stay healthy and safe. Thank you for joining us today.